Hi, my name is Pritika Patel, and I am a nurse practitioner here at Synapticure. We are going to cover two topics today. The first is emergency services, and the second is home safety. Starting with emergency services. So, what exactly is a medical emergency? I will say that this list, excuse me, is not in any particular order, nor would I say it's a comprehensive list, but these are certainly very common, important things to keep in mind. So the first is severe chest pain, also difficulty breathing or choking. Something that important to keep in mind is that if at baseline a person is having normal ability to speak, but then they cannot speak, and certainly if they're unconscious or unresponsive, then they're not breathing. Um, Also, seizure activity or severe bleeding. Next is stroke symptoms. And the image on the right-hand side is very helpful in spotting the early signs of a stroke with the acronym Be Fast. So all of these symptoms, if they suddenly were to have onset in a person, any person, it's a reason to call 911 because they're signs of a stroke happening. So the first is B for balance, loss of balance or coordination. E for eyes, changes in vision. F for face, drooping features on one side of the face. One side of the face is uneven from the other. A is for arms, but it is really weakness in both arms or legs. And then S is for speech, difficulty speaking or understanding others. The T is for time, so calling 911 or emergency services immediately. So this acronym quickly recognizes stroke symptoms to ensure immediate emergency action. Every minute saved reduces brain damage, or as some neurologists say, time is brain. So strokes are best treated, and patients experience the best outcomes and better recovery if treated early to the event occurring, if it can be detected as quick as possible. The next is severe allergic reactions. So, especially if someone has had a reaction to the point that they are not breathing. Next is either accidental or purposeful poisoning or drug overdose. And finally, behavioral changes, such that you're concerned for an individual's safety or the safety of those around them, including your safety. And I will say that unsafe behavioral changes is very distressing because your loved one is no longer acting like the person that you know, but understanding that this is a terrible part of the dementia process, and there are things that can be done to make sure that the person is safe or those around them are safe. So what can you do? This is something that I want to talk about, but I acknowledge that it's adding another thing to your plate, but I think it would also help take away things from your plate as caregivers as well. So keeping an updated emergency file, having paper copies of all these things. So the first is a list of current medications, including the medication name, dosing, and frequency. I've seen patients that have put together basically the labels from their prescriptions into a piece of paper, and that is how they're able to then show any clinician, nurse, doctor, nurse practitioner, paramedic who's asking about current medications. Then medical history, so things like diabetes or hypertension, congestive heart failure, Alzheimer's disease, Parkinson's disease, those kind of diagnoses, but also things like allergies. And then also to include the primary care provider and any specialists that the patient sees, their names, as well as phone numbers for their offices. Next is advanced care planning documents. So examples of this is a living will, a healthcare proxy form, or a medical power of attorney form. And then finally, contact information of loved ones. And I will say, if you're tech savvy, then keeping an electronic copy in your email or cloud storage like Google Drive or Dropbox is another way to make sure that you have the information readily available to you. If you do need to call 911, these are all things that are helpful and common questions that are asked by the paramedics or emergency services. And then certainly they'll also ask about the event that has happened, the last time someone ate or the last time they took medications. So being prepared. These are some things to do. So the first is checking weather conditions regularly and adjusting your plan as needed. So considering rescheduling non-urgent appointments if a storm is predicted, and asking a clinician's office if a telehealth visit is an alternative option in order to avoid rescheduling to a date that's much farther down the line. Knowing the emergency evacuation plan for your residential building or whether that is certainly you live in a home, an apartment building complex, an assisted living facility, but also places that you're going to regularly, like an adult day health program or a senior center. And in that plan, making sure that it takes into account any special needs of the patient. So, do they need a walker or a wheelchair? Are they oxygen dependent? Those kind of things. And going back to that emergency file, good for you to have a paper copy, electronic copy if possible, but also to give a paper copy to someone that you trust that lives outside of your home, whether that is a good friend, an adult child or grandchild, a sister, brother, that kind of thing. Um, Again, if oxygen is used to make sure that it's easily accessible, in regards to portable tanks. And if you have a pet, making sure there's a plan in place for their care in the event that you're not home. Ultimately, when in doubt, call 911. Call emergency services because they are there to help you triage a concern, and evaluate and help you decide about going to the hospital or not. Moving on to home safety. So, this is not a comprehensive list, and it will change depending on the stage and progression of the person's dementia, as well as their mobility abilities. So, for example, early in dementia disease process, signs or sticky notes with reminders, things like clear labeling can be very helpful. So, labeling hot and cold water faucets, for example, with the words hot and cold. Um, but unfortunately, as the dementia progresses, these kind of things will be more challenging for the individual with dementia to understand, but also process. So at that point, using simple graphic images is more helpful. So going back to the example of faucets, using a graphic of fire for hot and using a snowflake for cold. If possible, it's helpful to have your provider, whether that's care or neurology, order a home safety evaluation. And this is where a visiting nurse or physical therapist comes to your home and provides suggestions to help you navigate your specific environment and needs. And often this is helpful to repeat as the dementia progresses and different safety concerns become a problem. So the following slides are borrowed from the Alzheimer's Association's home safety checklist, which you can find online. We'll go through different areas of the home and some tips and tricks on things to keep in mind. So general home safety. Um, I will say that the biggest kind of overall or overarching thing to think about is keeping things as simple as possible. So one thing is to limit the size and numbers of mirrors in your home. Take down large mirrors or cover them. Because unfortunately, mirrors can confuse a person with dementia, such that they think there is an intruder in the home, or a stranger, and that can be scary. Um, Installing safety latches to doors, storage cabinets, drawers, especially not just where there are dangerous items, but also where there might be breakable or valuable items. Padding any sharp corners to furniture to prevent injury. And then consider adding a no soliciting sign either on your front door or front gate to prevent strangers from providing additional confusion for the person living with dementia. Um, it's a good idea to have emergency phone numbers, like an ambulance service, 911, poison control, um, offices of doctors or providers, and then also the person's address near all phones, landlines, especially, and then also on the refrigerator, so that it's easily accessible. So securing hazardous items like things, medications, alcohol, matches, sharp objects, small appliances, tools, chemicals, liquid detergent, bleach, other cleaning products, making sure that they're kept out of sight, and also securely locked away so that a person cannot accidentally ingest them. Keeping them in original containers is also an important thing to do so that you can identify what it is should you need to call poison control, and also so that it doesn't confuse someone for something else that could be ingested. Um, Making sure to maintain detectors like carbon monoxide and smoke in the home and regularly replacing their batteries. Removing tripping hazards from the home, things like throw rugs, extension cords, any excessive clutter in the home. Making sure to have adequate lighting throughout the home, keeping walkways and rooms well lit, using things like night lights, automatic light sensors. Securing large furniture, things like bookshelves, cabinets, large TVs, in order to prevent them from tipping or falling. And having supportive seating available throughout the home. So making sure that there are chairs with armrests because this provides support when someone is going from the sitting to standing position. Um, Marking glass doors or glass cabinets with stickers or decals at eye level, so then the person cannot confuse it for something that they can go through, that there is something there. Installing locks, so installing latches or deadbolts either above or below eye level of the person experiencing dementia, and using things like child locks as well. And there's ones for doorknobs can be very helpful. Removing interior locks to doors so that a person cannot accidentally lock themselves inside a room. And also securing firearms. So consider removing firearms from the home to prevent injury, but also thinking about storing them in a locked cabinet with a code that the person experiencing dementia would not easily be able to recall. Moving on to the kitchen. Using appliances that have automatic shut-off features, timer features, preventing unsafe stove usage by applying stove knob covers, removing knobs, or turning off the gas when the stove is not in use. Disconnecting garbage disposals, taking a regular look in the fridge to throw away any expired items, but also marking food with purchase date or the date that they were made on. Discarding toxic plants and decorative fruit that could be mistaken for real food. And again, with simplifying, removing vitamins, prescriptions, sugar substitutes, seasonings from kitchen tables and counters so that it's not something to confuse the individual experiencing dementia. A laundry room. So cleaning out lint screens, dryer ducts regularly to prevent fires, something we should all be doing. Consider installing safety locks to washing machines and dryers in order to prevent inappropriate items from either being put into the machines or taken out of the machines too early. Installing locks on laundry chutes to avoid temptation to climb into or drop inappropriate items into the chute. Same thing goes for garbage chutes. Keeping all cleaning items, again, out of sight, locked and secure, and also in original packaging. So then we're removing as much risk as we can and discouraging someone from eating or touching harmful chemicals. The bathroom. So installing things like grab bars for the shower, the tub, around the toilet provides additional support to help someone prevent falls. It's a big thing in the bathroom setting. Also things like shower benches, shower chairs. Setting the water temperature to 120 degrees Fahrenheit or less to prevent scalding. And applying textured stickers or mats to slippery surfaces to prevent falls, again, in the bathroom. The bedroom, closely monitoring the use of electronic blankets, heater, or heating pads to prevent burns, other injuries, providing seating in the bedroom to assist with dressing, and ensure closet shelves are at an accessible height so that items are easy to reach, hopefully to prevent a person from climbing onto shelves or objects falling from overhead. The garage, basement, shed, wherever you keep these kind of things. First is large equipment. We want to limit access, certainly as the disease process continues to progress for safety. Storing lawnmowers, weed trimmers, snow blowers securely, and if possible, out of sight. Again, out of sight, out of mind. Um, Once again, thinking about hazardous chemicals, making sure that those are secure. And also preventing tripping or climbing by locking ladders when they're not in use. If the individual living with dementia is no longer driving, then remove access to car keys. Don't make them easily visible. Things like installing motion sensors on the garage door, marking stairs with bright tape, whether that's inside or outside of the home, to be able to distinguish one step from another, or also when you're going from one surface type to another, places where falls are a big risk. And then making sure railings on staircases are sturdy to prevent tripping and falling. So I know that was a lot of information to take in. I will say that these are three helpful places to look after, even this meeting. The NIA, which is the National Institute for Aging, has their own list of safety tips to reference on their website. The Alzheimer's Association has a 24/7 helpline. And I want you to know that if you didn't already know, the Alzheimer's Association is not just for patients and families experiencing dementia, but excuse me, Alzheimer's, but really for any kind of dementia or cognitive impairment, they are there to provide support. And they also have a home safety checklist, which is available online. And like I said, it's much of what I was referring to in terms of tips and tricks throughout this presentation. Um, I will say, in my opinion, the best thing that you can do for yourself and for your loved one living with dementia is to request an order for home health from your primary care or from neurology provider, specifying a home safety evaluation, so that then a visiting nurse or a visiting physical therapist can come into your home and provide specific recommendations for your environment. Uh, and also to know that this is something reasonable to do several times as disease progresses, as things change, to help you with navigating the home environment. I want to thank you for your time, and uh, that's all. Thank you.